Welcome to my YouTube channel Nursing Career. On this channel, you will see all the nursing related MCQs. Please like my video and subscribe my channel. Today I discuss about Hpssb Staff Nurse Exam 2016. So now let's start with my first question. The axial skeleton consists of option A 40 bones, option B 80 bones, option C 100 bones and option D 126 bones, and its answer is 80 bones. My second question is adequacy of fluid replacement in a patient with shock is best determined by option A systolic blood pressure above 100 mmHg, option B diastolic blood pressure above 100 mmHg, option C urine output of 30 ml per hour, and option D urine output of 50 ml per hour, and its answer is urine output of 30 ml per hour. Question number third. The most common symptom of sliding hiatal hernia is option A feeling of fullness, option B difficulty in breathing, and option C gastroesophageal reflux, and option D all of the above, and its answer is gastroesophageal reflux. Question number 4. Which of the following is suggestive of breast cancer? Option A breast enlargement, option B breast tenderness, and option C darkening of nipple, option D unilateral discharge from nipples, and its answer is unilateral discharge from nipples. Question number 5. Quarantine is related to option A maximum incubation period, option B minimum incubation period, and option C serial interval, and option D generation time. And its answer is maximum incubation period. Question number 6. The symptom of hypoglycemia usually do not occur until the blood glucose level is less than 60 to 70 mgdl. Option B 50 to 60 mgdl, and option C 40 to 50 mgdl, and option D 30 to 40 mgdl, and its answer is 50 to 60 mgdl. The seventh question is persistent lack of appetite often occurring with vomiting and severe weight loss is referred to as option A stuttering, option B anorexia nervosa, and option C bulimia nervosa, and option D pica, and its answer is anorexia nervosa. And the eighth question is a nurse observed a convulsion and twitching of extremities in a newborn infant. What could be the probable cause for it? And its options are asphyxia, option B meningitis, option C cerebral hemorrhage, and option D infection, and its answer is a cerebral hemorrhage. Question number 9. The most common method of reproduction of bacteria is option A binary fission, option B sexual, and option C budding, and option D spore formation, and its answer is a binary fission. Question number 10. The best indicator for PEM is PEM means protein energy. Malnutrition is underweight for age, option B underweight for height, option C underweight for age, and option D underweight for economic status, and its answer is underweight for age. Question number 11. While assessing the vital sign of a patient having a recurrent attack of seizure, the nurse should take an axillary temperature every 4 hourly. Option B observe for bradycardia, option C observe for bradypnea, and option D all of the above, and its answer is take an axillary temperature every 4 hourly. Question number 12. A patient who keeps repeating a word over and over is demonstrating option A neologism, option B circumstantiality, option C stereotype, and option D senility, and its answer is a stereotype. Question number 13. The nurse is assessing the vital signs of a patient with a head injury. Which of the following findings indicate increased intracranial pressure? Option A tachycardia, option B bradypnea, and option C widened pulse pressure, and option D decreased body temperature, and its answer is a widened pulse pressure. Question number 14. A hormone that stimulates the flow of pancreatic enzyme is endocrine. option B, pancreatic, and option C, enterogastrone, and option D, cholecystokinin. And its answer is pancreatic and cholecystokinin. Question number 15. The object measurement of patient level of consciousness is best determined by using a Glasgow scale is called. Option A, consciousness scale, option B, communicable scale, option C, coma scale, and option D, stimuli scale. And its answer is a coma scale. Question number 16. When planning care for a person with burn on the upper part of the body involving face and neck, which of the following nursing diagnoses should the take highest priority? Option A, fluid volume deficit, option B, body image disturbance, option C, ineffective airway clearance, and option D, risk of infection. And its answer is ineffective airway clearance. Question number 17. After lumbar puncture, the nurses should: option A, encourage the patient to cough, option B, instruct the patient to bend knees when turning, option C, assess the patient for indications of peritonitis, option D, log roll the patient by using a draw sheet. And its answer is assess the patient for indications of peritonitis. Question number 18. The pulse pressure of BP 140 by 90 mmhg is: option A, 50 mm of Hg, option B, 90 mm of Hg, option C, 140 mm of Hg, and D, none of the above. And its answer is none of the above. Question number 19. The time required to read Monte's test is: option A, 12 to 24 hours, B, 24 to 48 hours, option C, 48 to 72 hours, and option D, more than 72 hours. And its answer is 48 to 72 hours. And 20th question is drug that contract the pupil of the eye is called myotic, option B, mydriatic, and option C, longinus, and is D, demulcent. And its answer is myotic. Question number 21. Antidote of magnesium sulphate is: option A, calcium gluconate, option B, diazepam, and option C, calcium chloride, and option D, nalorphine hydrochloride. And its answer is calcium gluconate. Question number 22. Which tumor is a condition affecting: option A, kidney, option B, bone, option C, liver, and option D, brain. And its answer is kidney. Question number 23rd. Waiter's stiff position is seen in: option A, Bell's palsy, option B, Erb's palsy, option C, facial, and option D, congenital dislocation of hips. And its answer is Erb's palsy. Question number 24. The relationship of fetal head and limbs to its trunk is called: option A, lie, option B, presentation, and option C, attitude, option D, position. And its answer is attitude. My last question is: Diagnostic of Rabies is: option A, Guinea bodies, option B, Negri bodies, option C, cow dry A bodies, and option D, cow dry B bodies. And its answer is Negri bodies.